Hello, beautiful people, and welcome to my channel. Hang tight while we connect. Instagram, I am so excited for today. So we're almost connected with Instagram. We want to include everyone. And looks like we are, yay, I think so, yes. We are live everywhere. So I want to say hello, beautiful people, and welcome to my channel. My name is Jennifer Diamond, and I'm a certified plant-based nutrition coach living a whole food, plant-exclusive lifestyle for health and well-being. And today I have a super special guest that I am thrilled to welcome, Dr. Shobha Rayapudi. Dr. Shobha is a physician, an epidemiologist and researcher, and she is certified by the American Board of Lifestyle Medicine. She holds a medical degree from Rangaria, I hope I said that right, Medical College, a certification in plant-based nutrition from Cornell University, and a Master of Science degree in epidemiology from Johns Hopkins University. Her principal scientific interests have been on the effects of nutrition in preventing and reversing chronic diseases. So she is also a certified yoga and meditation teacher, which I learned, and her life-saving work was featured in a documentary, Plantify. Is that right?
Yes, Plantify.
Okay. So today, Dr. Shobha is going to talk with us about arthritis. The different types of arthritis and the power of whole food plant-based nutrition to help maybe slow the progression and possibly even heal many types of arthritis. So I'd like to give a warm welcome to you, Dr. Shobha, and thank you so much for joining us today to discuss this very important topic. So it's so great to have you on the channel.
Thank you so much, Jennifer. Thank you so much for the warm introduction and welcome. And I am also super excited to be here because this is a topic close to my heart. And like I'm sure like many of our audience would benefit from our discussion today. So thank you so much for having me today.
Oh, absolutely. And I know last time we were together, you interviewed me on your channel, which was such a privilege. And that was when we were both promoting the 2025 Vegan Health Bundle, which was really a lot of fun. And I'm also really excited about today's topic, arthritis and how the right foods can be of great benefit. So yeah, if there's anything else you'd like to say before we start, any corrections on the intro or anything you'd like to add, please do.
No, you're good. I think like we are good to start, Jennifer.
Okay, I just want to take a second to say hello to everyone in the chat, everyone here. We appreciate you being here. And also, if you have any questions or any comments, please feel free to put it in the chat and we will do our best to make sure that we answer that. And I do want to say hello to Jill, who is in the chat as well. And so, yeah, so would you, so I guess, well, before we get started, I'm wondering if there is anyone in the chat who is either dealing with any form of arthritis or who knows someone who is. And while we're waiting for that, we can move on to start. And you know, you can let me know, Dr. Shobha, if you'd like to start or if you want me to ask you questions first.
Okay, I mean, I'll just give a brief this thing. So, like my background, like I'm a doctor, so like I just wanted to let people know, like even like how I came to this field, and it was quite an interesting thing. So one day after long day of work, after hard day of work, I come home and prepare a dinner for my husband. And he looks at the food and he says, I'm not going to eat this. I literally wanted to choke his neck. I said, like, what's wrong? Like, why you don't want to eat? By the way, I prepared his favorite meal. And the night before, he watched Forks Over Knives, and he was dropping truth bombs on me. So he was saying like the food I prepared had a little bit dairy, and so he was going all about like why, like that is not conducive for us to eat. So quite frustrated, I watched that documentary, and so at that time I came to know about a lot of plant-based doctors, and like what shocked me was the picture where Dr. Cardwell assistant, he shows the a picture of a clogged artery, and just by eating plant-based diet, like how that opened up. And that really opened up my eyes. I was like, why didn't I learn about this in medicine? But more than that, I was frustrated that I did 17 years of schooling and education after high school. So I'm not talking about. So after high school, like going through 17 years of further education, I felt that I was an educated person, but I didn't know about this. And that at that moment I felt something. If a person like me is not aware of this, I can see how a common person can stand a chance. So there is so much misinformation out there, and there's it's so easy for a common person to be confused about this. And that's the moment I decided that like I need to spread awareness about it. I definitely educated myself more about plant-based nutrition, and like since I wanted to help my patients, because every 3 months they would come back with the same problem. Either I'm increasing their dosage, increasing their pills, but there is nothing that is making them better. And I just felt that it was a failing system. Like neither I was happy, neither the patient was happy, and neither the system is happy. So, and that's the time I decided that like I need to change the way I'm practicing medicine. And that's how I just created a system outside the system. I would say, like, I know we call this as a healthcare system, but it's a sickness care system. So that's why I created Gift of Health, like where I could empower people, like give them the knowledge, give them the skills and support so that they can change their lifestyle. Because in my clinic, 80% of the diseases that I see are due to poor diet and lifestyle. Like what they're feeding themselves, what they're feeding to their bodies, what they're feeding to their minds is it's what is causing. So like, don't you think that is the thing that needs to be addressed? Only like when we are able to address that root cause, like we will be able to take care of any chronic disease. And you picked a great topic today, Jennifer, like arthritis. I would say we are living in an inflammation nation. And today's discussion, my hope is it brings awareness to people, because there are a lot of things. I mean, the common foods that we eat, so we take them for granted. Like seldom are we aware that like what they can do to our bodies and what diseases they can cause us. So I'm really excited for today's discussion, which I hope will bring clarity and awareness.
Wow, that is wonderful. And I am so excited to learn about your journey. And what a wonderful gift that you're offering by having the platform, right? Because of your education and being able to help people. I do want to just take a quick second and check the chat. Lisa is here and she says, good afternoon. And I mentioned Jill is here. And Jill Caperton says, I have a girlfriend who suffers from arthritis. And then we have Juju Nation. She says, uh, Juju, hello. Yes, my mother-in-law has arthritis, but refuses to change her habits of eating. So we do have people in the chat and watching already that either know someone or have experienced themselves this tough topic. And so, yeah, thank you to share that because we're all in this together. So,
Yes.
I'm wondering if you don't mind, maybe just starting out with what are the most common forms of arthritis that you see?
Yeah. So broadly, we can categorize arthritis into two types: inflammatory arthritis and non inflammatory arthritis. So, when it comes to inflammatory arthritis, a lot of you might have heard like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. Those are all the type of arthritis that happen because of inflammation. And mostly what is happening is your immune system is attacking. So that's why it's also known as autoimmune disease. So, like, auto means like your body is being attacked, and immune, like immunities. So, like, if you look, um, l- like, you have blood flowing through each and every part of the organ. So the red blood cells are delivering the oxygens to your body, whereas the white blood cells, they are like your security guards. So they pick up any bacteria or virus or any protein that is present. So they are like your security guards, and they try to wipe them off, kill them. So we can say that they do this by either shooting some antibodies, or we can tell them they're shooting arrows or torpedoes. So by that, so the bacteria or the virus or those things are killed. But in autoimmune, what is happening is when those white blood cells are shooting those arrows, it is hurting our own tissues. It's like our joints, they are being damaged. So that's what is happening in autoimmune arthritis. And obviously, there are also non inflammatory arthritis. You might have heard of gouty arthritis, and you might have also heard of osteoarthritis. So, osteoarthritis is a degenerative condition. And when it comes to, or when you think of what is the most common arthritis, osteoarthritis is the most common arthritis of all the types. I mean, there are more than 100 varieties of arthritis, but most important is what we need to know. The two most common that we hear most is the osteoarthritis and rheumatoid arthritis.
Wow, that is a very good, thorough description. I love the little arrows, and really was easy to follow. Now, on the two that you named, the osteoarthritis and the rheumatoid arthritis, is there anything that causes them that you know of? I mean, what causes arthritis in general? Maybe that's a better question.
Yes. So, like, when you look at arthritis or osteoarthritis, you take for example, so it is caused when the cartilage, it's like a cushion lining your joint. When that cartilage is breaking down uh, faster than how much your body can replace it, that's when we call it as osteoarthritis. So when that degeneration is happening and the cartilage is not being able to be replaced, so in that case, as I said, this is the most common form of arthritis. The most common age of being diagnosed is like usually when you're 55 years old. And if you are a male, there is 45% of males are likely to, sorry, 40% of males are likely to develop osteoarthritis during their lifetime, whereas 46 percent of women are likely to develop osteoarthritis during their lifetime. So this is how common it is. And coming to the question, like, what causes it, what do you think, like, when you think of treating osteoarthritis or arthritis, you think of pain medications, because typically what is arthritis doing? It is causing pain, it is causing disability, it is causing that lack of mobility. And just to get rid of the pain, we try to take medications. But I'm not saying medications are not important. Yes, they try to relieve the pain, but if I tell you there is a much better way, more profound and phenomenal way, then if that was a drug, like everyone would take it. But the thing is, that is something that is easily available to us, that is cheap, and that is powerful than the medications that we actually use for arthritis, and that is what we are putting on our plate. And like, if I just say that it's the food that can either cause arthritis, I mean, that can actually add gas to the fire, or it can put off the fire. So it's the most powerful thing is the food. And not many people even think that like the food can cause arthritis. And as I said, we are living in an inflammation nation. If we look at our environment, like what is that we are eating? Like if we are eating mostly processed food, or foods coming from animal based foods, that is causing inflammation in our body, and that is causing arthritis. And if you're wondering like how this foods can cause arthritis, so there are 7 ways by which animal based foods can cause arthritis. So would you guys like to know what are the 7 ways, like how uh, like, how this animal based foods can cause inflammation?
Yeah, I'm wondering if anybody has any guesses that they might want to put in the chat, that you might think why that would cause. We would love to know. And also, of course, who wants to know? Maybe you don't know, but guesses are always welcome to guess. And that's how we learn. While we're waiting to hear from that, unless you want to go ahead and just go for it. I did want to just mention, and you can answer this whenever. I notice when you say osteoarthritis, it has osteo in it, and osteoporosis is something that I'm dealing with. And I know that sounds like you were talking about it being in the joints. It's interesting that that word is associated, and so maybe at some point you can touch on anything that might share about why that is. Also, Jill says, I want to know. So thank you, Jill.
Okay.
And
Okay.
then we also have, let's see, we have Marley in the house. Hello, Marley. But we also have, yes, Lifestyle is Juju Nation would like to let us know that that is their thought.
Yes, obviously, lifestyle is a great risk factor, I would say, come when it comes to causing arthritis. And if we look at diet specifically, so what are the ways animal foods can fuel joint inflammation? So I'll just go over that briefly, and at the same time, how plant-based foods are, how they can heal the inflammation. I'll just for contrast, I'll cover side by side. So when we look at the animal foods like red meat, eggs, dairy, like all these foods are high in a fat called arachidonic acid. And when our bodies break it down, it creates inflammatory chemicals like prostaglandins and leukotrienes. And these chemicals, they directly fuel joint swelling, stiffness, and pain. Whereas when you look at plant-based foods, they're naturally low in arachidonic acid, and they provide fats that are either neutral or anti-inflammatory. So whenever like you're switching from animal based to plant foods, so what is happening is you're cutting off the fuel supply for damaging joint inflammation. So one way like how animal based foods can contribute to joint inflammation is they are rich in pro-inflammatory fats such as arachidonic acid. So they basically, what they do is they they put arachidonic acid overload. That's one way. The second way is like a lot of you might have heard of barrier or the leaky gut. So when we consume animal-based foods and processed foods, what they do is they can damage the lining of the gut by promoting inflammatory molecules and unhealthy gut bacteria. So mostly like this damage makes the gut leaky, allowing toxins and bacteria to slip into the bloodstream. And this is quite an interesting concept just to understand. So let's say like when you go to the hospital, sometimes you're put IV lines. Okay, so if you're not able to consume, so if we have to uh, inject any normal saline or any other drugs, like we put IV lines, right? So if I just put pure water or your drinking water into that IV line, you can die in 15 minutes. Why? Because when it directly comes in contact with the blood, it doesn't have the capacity to fight. Whereas when you drink that water, your gut, like it has the mechanism to fight all the bacteria, viruses, or the toxins that are entering into your body. That's what your gut does. So when the barrier, so the cells are really tightly packed in your gut, so that like whatever you're eating, it doesn't slip or it doesn't get past that gut blood barrier. But when in leaky gut, so those tight junctions are not tight anymore. So whenever anything is leaking from there, so with and technically it is allowing the toxins and bacteria to slip into the bloodstream. And when that is happening, like your body has to mount an immune attack. And and that is also one of the process how autoimmune diseases happen in your body. So typically like animal products and processed foods, what they do is they damage the lining of the gut, and those tight junctions are not tight anymore. That's how the leaky gut comes. The other thing is your gut bacteria depends upon what you feed. So the simple way I say is your gut microbiome, the microbiome that is inside your body, is like a garden. In your garden, do you want to grow flowers or do you want to grow weeds? When you eat animal based foods, you're growing weeds. And when you're eating plant based foods, you're growing flowers. So the choice is yours, whether you want to grow more flowers or whether you want to grow more weeds. So and this is a very interesting point, which many people may not be aware. We all know that we have cells in our body, and the fuel for our cells is glucose. Like every part of our cell needs glucose. It typically takes glucose and converts into ATP. That's what gives us energy. That's what gives our cells energy. But guess what? The, the cells of the colon, also known as colonocytes. Do you know what is the food for your colonocytes? Any guesses? Can you guess like what is the food for your colonocytes?
I mean, I'll wait to see if anyone has anything to say, but I would say that it has to do with whatever you're feeding your microbiome, and it's either the flowers or the weeds. How am I doing?
Yes, so your colonocytes can only feed on fiber.
Oh, okay.
They cannot take glucose. So if your colonocytes need energy, so the fiber is converted into short chain fatty acid. That short chain fatty acid, it triggers the mitochondria, like that's the energy production center inside our cell. So here for colonocytes, glucose is not the food, it's the fiber. And if you're not providing that fiber, your colonocytes are dying, literally. So that's why, if you know, like the most common risk factor for colon cancer is fiber. If you're not feeding fiber, it's very common for people to experience colon cancer. That's one of the risk factors. So, like, you might be wondering, like, why are we harping so much on fiber? So one thing is, it's the food for the colonocytes. The other thing is, even though as humans we want to think we are so powerful and we are made up of human cells, guess what? Like, your body has 30 trillion human cells, but you carry 39 trillion microbial cells. So I'm sorry to say that you're less than a human. You actually carry more microbial cells than your own human cells. And when it comes to the genetic proportion, 99% of the genetic code is your microbiome versus your own cells. So that's how powerful the microbiome. That's technically, you are made up of more microbial cells than the human cells. the so that's what it boils down to. So if you're not feeding that microbial cells, guess what is happening? There is a dysbiosis, there is an imbalance in your garden, so which we call as dysbiosis. There are more bad gut bacteria growing versus the good bacteria. So if you might be thinking, oh, maybe fiber is something that maybe it's just helps me to relieve constipation, or maybe it's just food for the bacteria. But you will be amazed to see that, like, fiber actually, it does so many things inside. Just to state few of the things that fiber can do. So once fiber is broken down, it converts into short chain fatty acids. And what is this importance of short chain fatty acids? So one is they lower the colonic pH. The other thing is they promote the growth of healthy microbes, or the good microbes. And the short chain fatty acids, they directly suppress the pathogenic microbes. And like earlier, I mentioned that it is the only source of energy for the colonocytes. And this short chain fatty acids, they increase the tight junction proteins. And the other thing they do is they reduce bacterial endotoxin release. So, where one of the things that happens when we eat animal based food, we call that as endotoxemia. There are endotoxins sitting on dead, decaying animal flesh. And when those endotoxins, people might be thinking, okay, I'm boiling my meat, I'm cooking, and when I'm doing that, maybe I'm destroying the endotoxins. No, even if you boil, even at high temperatures, that endotoxins, they're not destroyed. And once they get inside the body, they cause endotoxemia. And guess what? The fiber, it actually reduces that bacterial endotoxin release. And obviously, this is the fact that most of you know, it increases colonic motility, and it decreases the your gut hypersensitivity. So that's how important fiber is. Fiber has other benefits too. I mean, I know, like, we go so much gung-ho on protein, but I feel like fiber is the miracle, is the miracle nutrient. Because you know what, like, it affects every part of the body. Because what I say is, it has the metabolic effects, it has the immune effect, it has the hormonal effect, it has the neuropsychiatric effect. It has effect at all levels. So the short chain fatty acids, what they do is, the other thing which you might be happy to know, is it reduces the fat storage. And it also increases the release of satiety hormones, so you feel satiated, like it controls your appetite. and it regulates your blood sugar, it enhances your insulin sensitivity, and it reduces your gut inflammation. Basically what it does, it makes your immune cells more tolerant of the food that you're eating. It makes you more tolerant to the gut bacteria, and that's why they say 70% of the immune system, it actually resides in your gut. And and this is the thing, it also gives you that dopamine hit, because short chain fatty acids are something that can cross the blood brain barrier. So the short chain fatty acids that are formed inside the gut, they can cross the blood brain barrier, and there they can provide the serotonin or the neurotransmitters. Actually, like 50% of I would sorry, like 90% of your serotonin is actually produced in the gut. And the other good thing is the short chain fatty acids, they actually block the production of amyloid. So a lot of you might be familiar with Alzheimer's disease or dementia. So eating fiber, it actually improves your memory and decreases your risk of having Alzheimer's disease, and it protects your brain from like Parkinson's syndrome, and it actually improves your cognitive control. And especially people, if they have ADHD, eating more fiber, it improves their cognitive function. And I know, like, I can go on and on about fiber, but it is so important. I mean, that's how important like eating plants is, because where do you think fiber is present? In plants. How much
In the
fiber is
plant.
present in animal based foods?
Zero.
Zero, right?
Zero.
Yes. So the more plants we feed, the more benefits. I mean, we are doing our body a favor when we eat that way. I know, like, I digressed a little bit with
No.
the fiber, but I know I was listing the 7 ways, like how animal based foods. So one is they load up on pro-inflammatory fat. The other thing is they can cause gut dysbiosis, because as you see, like, animals have no fiber. So like if you're um, not providing enough fiber, it is causing dysbiosis. The other thing is it causes leaky gut. The other thing is a lot of toxins are stored in the fat of animal-based foods. So like PCBs, dioxins. So when you eat those foods, they actually disrupt your hormones, and they also cause a lot of inflammation inside your body. So that's one way. The other way is when you eat animal-based proteins. So it causes weight gain, deposition of fat. So there's a lot of saturated fat in animal-based food. So the saturated fat and the trans fatty acid present in animal-based foods leads to adipose tissue accumulation, and the fat itself acts as an inflammatory substance in our body, because it secretes like interleukin il, cytokines. These are very inflammatory substances which cause inflammation in our body. So that's another way, like how animal based foods can increase inflammation. And the antidote, like when you eat plants, they actually I would say fiber is the most anti-inflammatory nutrient that you can find on this planet. So when basic technically, like when you're eating a fiber, it is reducing the inflammation in the body. I'll stop here. I know, like
Yeah. No, this is amazing. I'm like, oh my gosh, this and that, and I'm thinking and appreciating how you're explaining things. And I just want to take a couple minutes to go into the chat. We have had some comments and a few questions, if that's okay, or we
sure.
can do it at the okay. So I know that Nancy Brown on Instagram. Oh, she just guessed that bread and wheat were were the culprit when we were talking.
Mhm.
And then let's see, let me go back here. We had a couple questions. We have a question. Is there a food that eases the pain of osteoarthritis? Asks Kathleen Michaels.
Yes, that's a wonderful question, Kathleen. So, this is a study. So, this was the greatest prospective study done on osteoarthritis patients by NIH. So, they took people like who were having osteoarthritic pain, and they were randomized into two groups. So, one group of people, like what they did is they asked them to eat plant-based food, and to other group of people, they were I mean, the standard of care is, so let's say if you're experiencing any knee pain, like you go for knee surgery. So they were comparing surgery versus eating plant-based food, like when it comes to pain reduction. And they were amazed to see that like 2 weeks of plant-based eating actually lowered the pain levels. There were also other trials done comparing, like if you take medications, is that going to reduce the pain? And interestingly enough, so NSAIDs and Tylenol. These are the common drugs that are prescribed when you have pain. So they found that Tylenol was decreasing your pain by, so here the pain scale was 1 to 100. So Tylenol was decreasing the pain by 26 points. And the other group, they were given placebo, and the placebo was decreasing the pain by 23 points. So the difference is only 3 points. So even you might be thinking maybe medications maybe are the better solution when it comes to pain. But unfortunately, when we are looking at these trials, what they're showing is the medications are not much different from the placebo. Like you might as well as eat sugar and feel the reduction in pain, like rather than taking NSAIDs or Tylenol, because they have a lot of side effects. These medications do not come without side effects. The other thing is when you go for knee surgery, like what is happening, and they compared this because in US alone, they do more than 700,000 knee surgeries happen over a course of year. And one of the complications of knee surgery is that patient can die within 3 months. So 1 in 200 out of 1 out of 200 knee surgeries, so one patient out of 200 people can die within 3 months of that knee surgery. So you might thinking, okay, this is not a lot, but as I said, like almost 700,000 knee surgeries are happening. So this is not a small number when it comes to death. And they compared the knee surgery with reducing weight. If a person, and this is very interesting fact, if a person just loses 1 pound per year for 10 years, you can reduce your osteoarthritic pain by 50%. And I'm just talking about 1 pound per year. I'm not even talking 1 pound per month. So even if you just lose 1 pound per year over the course of 10 years, that can decrease your osteoarthritic pain by 50%. And the other interesting research that they did, what they did is they took the cartilage of the people who were referred to surgery because they were having excruciating pain. So what they did is they took animal fat and dripped the cartilage with that animal fat, and they could see that the cartilage was destroyed faster when you're dripping animal fat. Again, when they dripped fiber into it, they could see the regeneration of cartilage. So that's how powerful it. So food is more powerful than pills and procedures, I would say, and that's what studies are showing mostly. So it's when it comes to pain, yes, eating plant-based foods can improve the pain. It can improve your regeneration of the cartilage, especially if you're experiencing osteoarthritis. And as I said, osteoarthritis is the most common form of arthritis that people experience.
Wow, that is a great question and an awesome answer. Yeah, so a couple things. Osteoarthritis. You were referring to knee pain and knee surgeries, and that's because that's the one that like wears down and breaks down the cartilage in the joints. That's what you were talking about when they ripped the fat from the animals versus they, put the fiber, and that's
Mhm.
why choosing the right the foods that are going to help us the most
Mhm.
matters. And so, autoimmune disease isn't that what it is? Because that's attacking the joints and causing the inflammation. And so, you really want to keep your levels of inflammation down, like you had mentioned before.
Mhm.
Um, and so I really appreciate that. We did have another question, but I do want to say, I do want to go back to fiber really quickly, because I know it's very common with people that eat the standard American diet, and maybe they don't even know, and hopefully they're learning now and watching this, but there's so many over-the-counter fiber powders. And it's very different, wouldn't you say, than eating the fiber in its natural form, whatever it is. Maybe you could touch on that for a minute, and then we'll go to a question here in the chat.
Sure. I mean, fiber is a package when you eat in its natural form. Even though you might be thinking, like, I'm just going to take a part of fiber, make it a supplement, it's not the whole product. Like, you are extracting, and there are so many chemicals and substances unknown to you. So even though you might be thinking you're extracting fiber out of a food and you're packaging, making it into a powder and consuming that, the whole food, the whole package is definitely more powerful, different. It acts in your body in a different manner when it comes compared to like when you just make it as a supplement and feed it. I mean, I would say that's the short and sweet answer. So it's it's always better to eat the fiber coming from the natural foods rather than having in the form of supplements.
Yeah, I would imagine that our bodies look at that like, that's not exactly the way that I'm, waiting for
Yeah.
it to come through. And of course, with the foods this way, when you get the fiber, of course, you're getting the water and the nutrients, and everything's balanced, like you said. And so, I wish that the medical Western medicine would share what you're sharing, and I'm so glad you're here to share it. Else had a question here. Else says, could you explain the connection to my constipation? I have Sjogren's. So a
Yeah.
lot of people do deal with that autoimmune disease, and if you'd like to touch on that, that would be great. Thanks for the question, Else.
Yeah. So again, Sjogren's syndrome is an autoimmune condition, and like as we were talking earlier about autoimmune condition, what is happening in autoimmune condition is like your if your gut microbiome is not being fed, or let me put it this way, when is this autoimmune condition is happening, like when the tight junctions are not tight anymore and the food is leaking through your gut, basically through your leaky gut, and they're coming into the bloodstream, and that's when your body is attacking, which we call as autoimmune thing. So basically in Sjogren's syndrome also, like what is happening is not enough fiber is being provided. And unfortunately, as I said, we are living in a world where we are surrounded with loads and loads of foods that contain zero fiber, or processed foods that are loaded with saturated fat or trans fat. So a combination of zero fiber, more trans fat, more saturated fat, this combination of combination of three things is the recipe for autoimmune diseases. And in Sjogren's condition also, like what is happening is you're not getting enough fiber, and constipation is one of the sign of not having enough fiber. So one of the things in constipation is also is your gut motility is decreased. And one there are two types of fiber: soluble fiber and insoluble fiber. So, and each have its role. Like insoluble fiber, it acts like brushes, and it also increases the peristaltic movement of your gut. So here, like eating more fiber helps, but here's the caveat: once you start eating that, you don't actually feel good, because it's just like, if on day one, if you go and lift 100 pounds, you won't be able to lift it. The same thing with fiber. You want to slowly increase the dosage of fiber, but for people like who are not eating much fiber, and all of a sudden when they try to take fiber, it's very difficult for them to digest. It's just like on day one you're trying to lift 100 pounds, which you won't be able to tolerate, and you will experience a lot of pain. The same thing happens with fiber. When you try eating this food, you actually don't feel good, and you try to go back to your previous habits, or not eating enough fiber. So you have to slowly build yourself up. So just like how, like you start with those 5 pounds, then slowly increase to 10 pounds, so where your muscles are getting a chance to get stronger. So here's the same thing: you're giving a chance for your gut bacteria to grow and strengthen. So that's why it's very important that you slowly increase your fiber consumption. And I know, like while we were having the discussions during the pain, people who eat 25 grams of fiber, that's the daily recommended intake of fiber. Unfortunately, 95% of the people don't even meet that minimum daily requirement. When you eat 25 grams of fiber, it has shown that it can decrease your pain more than 50%, and it decreases the chance of developing osteoarthritis. Earlier I said like 40% of males and 46% of females can develop osteoarthritis during their lifetime. But if you're putting or eating at least 25 grams of fiber every day, you are decreasing the probability, you're decreasing the chance of having that osteoarthritis.
Oh my goodness, that's a huge number. Wow. And it's just so amazing. The more I learn about the plant foods and the plant kingdom, it's just the more I want to coddle it like a little baby, because it's so wonderful for us and helps us in so many ways. So I'm just wondering, what signs should people look for if they suspect that they're dealing with arthritis? Maybe they haven't been diagnosed, but they're having symptoms. Is there anything that you would say that someone would be aware to look for if they're thinking, oh, maybe this could be something like an arthritis?
So arthritis is a very vague field. Like my rheumatologist friends say, it's like a detective work, because there is not a I mean, there's not a blood test or a marker which will tell you, okay, this is the sure sign. Just like I know there are a lot of diagnostic tests, but like rheumatology is awake field in the sense it's like detective work, because you go by certain symptoms, you go by certain tests. When it comes to rheumatoid arthritis, yes, there are certain blood tests by which you can test for specific antibodies to see like if you are having rheumatoid arthritis. But for some form of arthritis, it is hard to tell. But based on the symptoms, whenever you're having pain and type of symptoms, so like where is the pain happening? Is it happening at the base of the joint? So if it's happening that, it is osteoarthritis. But if it is happening at your interphalangeal joints, like most likely it might be rheumatoid arthritis. So based on symptoms, so like your doctor would diagnose based on the symptoms that you're experiencing and based on certain blood tests. But as I said, there are no like clear cut blood test or markers to tell you, okay, this is arthritis. But one thing is, people know when they have arthritis because they experience the pain. So pain, stiffness, a loss of mobility are the common symptoms that people experience when they have arthritis.
And with certain arthritis, I know some people, their joints and their fingers change, and then their abilities change. Is that a specific type of arthritis? And is there a food that can slow the progression of something like that or stop it?
Yeah. So in the symptoms you were describing, we see that in rheumatoid arthritis. And rheumatoid arthritis is inflammatory arthritis. So basically, what is happening is because of the inflammation in the body, you're experiencing those symptoms. So here the goal is to reduce that inflammation. And as we said, fiber is the most anti-inflammatory nutrient that you can find under the planet. So when you try to feed or increase the intake of fiber, it helps you to cool down or soothe down that inflammation.
Wow. Now, is arthritis genetic? Because a lot of people that I have worked with in my, coaching, and also just people in general, sometimes when they are eating standard American diet, they'll say, well, yeah, I don't need to change because this is genetic and this is just how it is.
Yeah.
And I mean, maybe it is genetic, but well, let me ask you, is arthritis genetic?
So, twin studies suggest that 50% of osteoarthritis are genetic. So, again, here, so as we say, genes are like your menu, or just because you have the genes doesn't mean those have to be expressed. As we say, genes load the gun. It's your lifestyle that pulls the trigger. So it's the food that you eat either expresses that genes or mask that gene. So you might have heard of epigenetics. So epigenetics is the field like how your gene expression depends upon the type of food that you're eating. So I would say you are more in control. Let's say even if you have those genes, what about the rest of the 50%? Rest of the 50% is under your control. Um, when you reduce your weight, when you reduce your intake of saturated fat or trans fat, or increase the consumption of fiber, that's totally under your control. So I would say even if you have the genes, you are more in control of what you can do to take care of that arthritis.
Okay, so there is a component where we do have a little bit of control. It looks like a lot of control. And so if somebody is trying to work with the right foods, such as a whole food plant-based lifestyle, is SOS and gluten-free lifestyle a factor? And SOS is sugar, oil, and salt. Removing those things, does that help with this type of problem in terms of lowering inflammation or other factors?
Absolutely. If you look at oil, I know like you can think, okay, maybe it's coming from olives or it is coming from plants, but oil is nothing but pure liquid fat. Is there any fiber in the oil? No. Is there any proteins or vitamins or uh, and like anything that is serving your body? No, I know like we are so uh, like I know we love to have that oil or sugar or salt on our food, but technically they provide like when you look at sugar and oil, they're providing empty calories. So I like they can be categorized as pure junk food, and they have no fiber. They are processed, so you definitely want to avoid them because and when you're eating them, it increases the risk of having osteoarthritis. Earlier, as I was mentioning in one of the studies, when the saturated fat and also like trans fat, when those are dripped, so it destroys your cartilage. Cholesterol, it destroys your cartilage. So when you avoid eating those foods, you are actually protecting your cartilage. So it's definitely better to uh, avoid salt, sugar, oil, like if you can avoid. And I know like for some of you, you might think it's difficult, but Jennifer shows you how to like amazingly create so many recipes like without using SOS. And coming to gluten, so when different foods were compared in terms of inflammation, in terms of decreasing arthritis, the number one culprit was dairy. The second one is chocolate, and the third one is like mostly like saturated fat, and like fourth one is citrus fruits. And like if you just go down the list, the fifth and sixth is wheat, like which contains gluten. So I'm not saying that like you need to avoid all this, but if you're really experiencing arthritis and you want to get rid of it, like you want to take away this food. So you want to take away dairy, chocolates, citrus fruits, gluten away from your diet, and see how you're doing on these foods. I'm not saying that everybody would have gluten sensitivity, like the 1% of the population definitely experience like either celiac disease or gluten sensitivity. So they definitely need to avoid gluten. So if you're having problems, it's better to avoid these foods and see how you're doing without it. Because you will see a major difference.
Wow. Okay. We do have a couple other questions if you're still okay. Um,
Sure.
Okay, and also I just want to mention, so just to the SOS, the salt, oil, and sugar avoidance. I understand that sugar feeds things like cancer and certain diseases. Is that the same for arthritis? Does it actually feed it and help it, not help it, but make it get worse? In some
I
people,
mean, it increases inflammation.
okay.
So yeah, it triggers inflammation.
Okay, so let me see here. We have a question. And can Raynaud's cause rheumatoid arthritis? I have Raynaud's, and my first joints on some fingers are deformed.
Yes. So again, Raynaud's is also a condition like you get like extreme pain, and even like when you're exposed to harsh temperatures. So it's again it's a form of autoimmune condition as well. Yes, it's just to answer the question. Yes, it's a form of autoimmune condition.
Okay, and that was from Mona. Thank you, Mona. Um, I hear, let's see, I see from Juju Nation. I am trying to do my best eating whole food plant-based diet, but however, my blood pressure just still is getting high. Any information is deeply appreciated. So that's a good question. How does somebody combat that? Because yeah, why is that happening? Just in general, we're answering these questions, of course.
Yes, yeah, yeah. So, like, whole food plant based diet is also a spectrum. I know, like, since I am not sure like what you're eating on a daily basis, so I'm just presuming based on your question. It's a spectrum of eating. So the more we move towards fresh food, like raw food, because like cooking also creates what we call as AGEs, advanced glycation end products. So more our food is cooked, charred, that is going to produce AGEs. Whereas, like when we are consuming the food in its natural form, raw form, that is more healing and soothing to our body. So the more you tend towards whole food, plant-based, it's the more you're eating in natural form, like instead of going for processed foods, either in the form of bread, tortillas, leaning more towards whole food plant-based helps, or like increasing your raw consumption also helps. And when it comes to blood pressure, yeah, the foods that we eat, it's not only helping with arthritis, it also helps with blood pressure. And blood pressure is multifactorial, like a lot of things cause blood pressure. It's not only the food, the stress, the amount of exercise, lot of things impact blood pressure. The amount of saturated food and salt, the amount of salt that we put in the food also impacts blood pressure. Um, so since as I said, since I am not aware, like I won't be able to answer specifically in terms of like what is that you can do. So only once I take your dietary history, I may be able to give you specific answers in terms of like what you can do to lower your blood pressure.
Excellent, excellent. And so, if somebody is like, okay, they heard all the things that you're sharing and they want to start, they don't know where to start. What is the very most important, you would say, if somebody is interested to change their eating? Where could someone start if they're like, oh my gosh, I don't know how to do this? You know, what would you suggest?
Yes. So now, actually, I had this a document which people can download. Maybe what I'll do is I'll send it to you, Jennifer, and maybe you can share it with your group of people. So basically, what the document does is it lists the foods, and it is like a check mark where you're able to see, okay, how much fiber am I getting per day. It's like a fiber checklist. So it tells you the foods, like how much amount of fiber is present in each type of food. And it also gives a meal plan in terms of like how you can eat in a way where you are getting more than 40 grams of fiber per day. So it's giving you a meal plan, it's giving you a checklist, and like you can see for yourself, you can track for yourself how much fiber you're getting per day. So I just call that as a friendly fiber a checklist, which I'll forward to you.
Oh, that is amazing. Yes, we'll be able to put a link in and share that with
Mhm.
everyone. Thank you for that wonderful gift. We are at the hour, so it's up to you if you're okay to keep going. We do have more questions, and I understand, and I want to respect your time. And so you let me know how you're doing.
Yeah, I can take a few more questions. Yeah.
Oh, okay, very good. So let's see. I'm just checking to see. Let's see. Um, Just looking here. Sometimes I have to go back. And so while we're looking at that, I will ask this question. Um, so, do other factors, other life factors, play a role in healing someone who's dealing with arthritis? Like when I talk about different factors, I mean like stress levels, or sleep that isn't consistent, or lack of exercise, those kinds of things. Do those really play a factor? We've been talking so much about food and fiber, which is so important, but I'm wondering about that.
So, like the besides food, like one of the thing is our BMI or weight that we carry. That plays a huge role. Um, so if ideally, like we want to have our BMI less than 25. So if it's more than 25 or 35, that plays a huge role in cartilage degeneration and having arthritis. That's one of the lifestyle factor, I would say. And when when it comes to lifestyle, it's multifactorial in the sense, okay, if you're not sleeping properly, your eating goes out of whack, your physical activity goes out of whack, so many things go out of whack. So like if you're not attending one, like it's just like a domino effect. So if when your sleep is compromised, your food might be compromised, your physical activity might be compromised, or when your food is compromised, your sleep might be compromised, your stress levels, you may experience stress levels. So like yes, like all this lifestyle, they I would say there are different pieces of the puzzle. So I'm not saying that they don't matter, but this is like if it's seeing the whole picture. uh, like we call this as 6 pillars of lifestyle medicine, like nutrition, exercise, restorative sleep, how do we manage our stress, avoiding harmful substances, and forming meaningful connections. So all these 6 pillars of lifestyle medicine are important. Like when we incorporate that, we have a better life.
Wonderful, wonderful. We have a question here from Marley. Are there any blood markers for Raynaud's?
So again, as I said, like this is a very vague field. Like you go by symptoms, and so anyhow, like I'm not an expert here. So, but my rheumatologist colleagues, they might be able to help you much better. Since, as I said, so like I'm not a rheumatologist here,
Yeah,
but
yeah.
so. Mhm. But in terms of blood test, as I said, there is a lot of vagueness in this field. So when you go to your rheumatologist, they will assess you based on symptoms and different markers and blood test.
Thank you.
Mm.
Yeah, is gout a form of arthritis?
So there is also what is called gouty arthritis. So what is happening in that is there is crystal deposition around your joints, and that is causing arthritis. So as I said, like arthritis can be caused because of inflammation, it can be caused because of the degeneration of the cartilage, or it can be caused because of the deposition of crystals around your joint. So there are like a lot of factors that can cause arthritis. So gouty arthritis is a type of arthritis that is caused because of crystal deposition.
Wow. Okay. So, a lot of things that I know, foods that are anti-inflammatory, I wonder if it would be helpful, like turmeric or
Mm.
garlic or
Yeah,
curcumin.
yeah. So, like when it comes to anti-inflammatory substances, yes, like spices, and there are certain things that are anti-inflammatory, and lots of studies have been done. So, so one is curcumin or turmeric that you mentioned. It is highly anti-inflammatory, and similarly, when you add onion, garlic to your foods, it's good. Like all these foods, ginger, and even studies have been done on strawberries. So like all this, these are all different types of fruits, vegetables, spices, herbs that you can use that are anti-inflammatory.
And you want to use it in the whole food form, not a supplement, right? Am I right?
Yes, yes.
And
A lot of people think it's difficult to consume turmeric, or they take this turmeric capsules and supplements, and they take a lot of dosage. Like especially like when it comes to turmeric, you just want to have that small quantity added to your food rather than in the form of supplements and all that. And when you eat it with pepper, it increases the absorption of turmeric. Yeah.
so it's really important to have the black pepper, as long as you don't have an allergy or something, with the
Mhm.
turmeric for better absorption.
Yeah.
And I use turmeric fresh. I put it on my salad raw.
Mhm.
I'll just grate it or put it in a smoothie. There's lots of ways to add it into foods that you wouldn't think. But like you said, it's a wonderful wonderful thing here. We do have a question here. From Juju Nation. My 89-year-old mother has type 2 diabetes, high blood pressure, and atrial fibrillation. She
Mhm.
cannot drink too much water or else her feet will be swollen. Is there a way that she can drink more water than what she is drinking presently?
So, given her condition, as she mentioned, she has diabetes, blood pressure, and one more condition she mentioned,
Atrial
atrial
fibrillation.
fibrillation. So, one is like a lot of things are going on there, like with other comorbidities, because you also want to make sure the kidneys are doing the job. One of the things that are affected when you have high blood pressure is your kidneys are affected. And when they don't filter properly, you have accumulation of fluids in your legs. So, more than rather than drinking water, there are other things that are causing the trouble. So those need to be fixed, or those, so when she sees her doctor, so they will be able to assess her kidney function, like what's her glomerular filtrate rate or the GFR, and if she has any what stage of kidney disease she's experiencing. So those things, they need to be sorted out first. It's not just about drinking water, but there are other things that are happening that need to be taken care of. So she needs to see a physician, and uh, those things need to be taken care of.
Yeah, find out what's causing that. This is great. And so I'm so happy that everybody has been asking so many questions. I'm wondering, do you have any last thoughts that you'd like to share with our group here?
I know, like you have that powerful thing. So when it comes to, not without thinking too much, I would just say grow flowers in your body rather than the weeds. So give uh, foods that love you back, that can heal you. So like when you're giving more plant-based foods, and this is not something that can happen overnight. So this is a journey, this is a process, and you could just start with one single step a day. So you could just it's the tiny habits or the tiny things that we do on a daily basis matter. So no matter where we are in the journey, it doesn't matter, even if we have not done it until now, today can be the starting point. As we said, the more we know about it, that's the time we are able to take action. So, with this knowledge and from today's session, if there is one action that you can take, so it could be just adding more fiber, maybe eating that half cup of beans, or adding that half cup of beans to your food, or adding a half cup of berries. So from whatever you're doing, see what is that one small action that you can take, and and improve. Yeah.
I love that. I love that. And I'm gonna think all about that beautiful, garden and flowers growing instead of the weeds. I love that analogy. And I just want to thank you so very much for your time and expertise. I feel so blessed and grateful to have had this opportunity to chat with you, Dr. Shobha, and learn from you. Thank you, everybody. Who has been here asking all the questions. And I just want to say, now we know to up our fiber and do these amazing things. So don't forget to eat your greens. And like I always like to say, give plants a chance. And we look forward to seeing you guys next time. Thank you so very much. And we will take care. Bye for now, everyone.